cardiac MR and CT imaging. So we're going to start out with some cardiac MR imaging. And I just wanted to point out that cardiac MR imaging is very, very new. It's just been developed in the last several years. Primarily in the last 5 years is when it's been rolled out clinically and been very, very useful. So some of the advantages of cardiac MRI are obviously the lack of radiation that you get with CT, but also enhanced resolution of soft tissue structures that you aren't able to get with CT. So it's very useful for the heart. Obviously, it would be, or it seems difficult to imagine MRI being used for something like the heart when obviously the heart is obvious, it's always beating. An MR requires no movement. So there's been new algorithms, new methods that have been developed in order to allow for visualization of a moving object like the heart with magnetic resonance imaging. So we're going to look at a couple of examples here. Keep in mind that these tend to be fairly difficult to interpret, so we're going through this to try to help reinforce our knowledge of thoracic anatomy. So in this image, you'll notice the liver is clearly outlined over here on the right hand side. You can see the inferior vena cava. This is just above the level of the liver at this point. And then over here you can make out the heart. The black arrowheads right here represent the pericardium, so you can just see this thin line which represents the pericardium. And then right here we have the right ventricle, and over here you can see just a small part of the left ventricle. So we're at the very inferior most part of the heart in this image, and then back here you can see the descending aorta right there. So looking at another view, we can see right here, this is at the level of the main pulmonary artery or the pulmonary trunk, and so you can see this is where it's bifurcated into the left and right pulmonary arteries. Back here we have the descending aorta. Here's the ascending aorta right at the sinus of Valsalva. So this is right where it's basically beginning. And then the superior vena cava you can see located just to the right side of the aortic arch. And then these two arrows are just pointing out a couple of different spaces. There's a pericardial space here, and then one just anterior to the aorta located right there. So don't worry about those spaces. Primarily we're just looking at these actual vascular structures related to the heart. So here we have a series of images from the same patient with different sequences in A and B, and then a different projectional view in C. So don't worry too much about the details on this one. I just wanted to point out a couple of things. First off, you'll note the pleural effusion pointed out by the black arrowheads down here bilaterally in this individual, so you can clearly see that they have an effusion in both of their pleural cavities. And then up here in the around the pericardium, you'll notice that both the visceral and the parietal pericardium is thickened in this individual. So this is actually not the wall of the heart, but instead it's actually the thickened pericardium. And then the thin line right here that's labeled 3 represents the small amount of pericardial fluid that is still present within the pericardial cavity. And then in this view, you can see obviously this is the right atrium as labeled, and then you can see part of the right ventricle and the left ventricle over here. And then this view over here on the right, this is just a slightly different sequence, and so that's why the blood now appears a lighter color compared to the dark kind of blackish color that the blood has on the image to the left. And so once again, you can just appreciate the same basic structures. This would be the interventricular septum located right here, and then again you still have that thickening of both the fibrous pericardium or parietal pericardium as well as the visceral pericardium in that image. And then over on this view, this is a gadolinium enhanced MR image, and so in this case what you can see, what you can appreciate is first off the view. So this represents the left ventricle here, and this represents the right ventricle. So this is a pretty typical oblique short axis view that we oftentimes will use in cardiac imaging and cardiac MR. And so the left ventricle is going to remain more posterior relative to the right ventricle. So just kind of keep that in mind. And what you can notice here with the gadolinium is you have enhancement of the pericardium in this case, so you can see how much the sort of thickening that's occurred in the pericardium in this patient. So here we have another example of a sort of this sagittal view of the heart on MR imaging. And so what we have pointed out here by this arrow is this is the interventricular septum. So you can see this is the left ventricle and then the right ventricle. So again, this is shifted a little bit more towards the left side of the patient. You can also actually see the kidney down here on this view. But in any event, you can really clearly make out that interventricular septum, left ventricle, right ventricle. And then over here, this is where the contrast has been allowed to cycle through the body. So, and the image on the left, this is an early image. So the contrast agent is still clearing the left ventricle. And then by this image over here, now it's filling back up into the right ventricle. And so that's why you get that hyper intensity in the right ventricle. And then you can, again, visualize the left ventricle as a darker structure just posterior to it in that other view. Now in this oblique view, what we're able to appreciate is this is a good two-chamber view looking at both the left atrium and the left ventricle, with the mitral valve obviously located right in between the two. This person, it appears, had a myocardial infarction that affected the anterior wall of the left ventricle. So these arrowheads right here are just indicating that there's the evidence of akinesia, or a lack of movement of the anterior wall of the heart here in this case. And then down here, you'll notice that these arrows that are labeled 3, these are just representing a small pericardial effusion. So again, a sort of swelling that's occurring in the pericardial space. And then over here on the right, it's just another view of the same case. I'm using a slightly different sequence, but again, you can still appreciate the same basic features of the heart in this view. On this image, this is now an actual coronary arteriogram where, once again, this is using MR, but we're trying to appreciate the different coronary vessels, especially the major ones. And so you can see just a couple of things highlighted in the image labeled A. So you can see the right atrium, the left ventricle, and then the pulmonary trunk or main pulmonary artery right here. And then this would represent the aorta. You can kind of make out part of the leaflets of the valves, or of the aortic valve right here. So you can see that we're right about the sinus of Valsalva at this point. And so you can see where the right main coronary artery is branching off and looping around right here. And then over here, this is again a small pericardial effusion that you're able to appreciate and labeled by those 3 stars. If you move over to the image on the right, so image B, once again we can see the aorta and the right ventricular outflow tract right here, the left atrium, and then the left lower lobe pulmonary vein that's coming in and dumping into the left atrium. You can see one coming from the right over here as well. This is just a pericardial recess right here. The superior pericardial recess is what's being pointed out right there, so you can kind of ignore that. And then right here we have the left main coronary artery. So the left main coronary artery. Now, it can be a little bit difficult to discern exactly what you're looking at in terms of the branches, but effectively what we have here is you have a marginal branch coming down right here, labeled number 3. This is going to be the LAD, the left anterior descending, or the anterior interventricular, labeled number 2. So the way to tell that is, remember that has to run around anteriorly, and it's going to run in between the right and left ventricles. And so obviously this is going to be the right ventricle up here, so that's where that one is traveling to. And then the one that's coming around this way, this is going to be the left circumflex artery that's looping around the posterior aspect of the left atrium and supplying much of the left posterior aspect of the left ventricle. And then down here, this is a little bit of an anatomical variant based on where the 2 arteries are coming off here, the right and left pulmonary arteries. But you can see the right pulmonary coronary artery. So this is the right coronary artery that's pointed out by these black arrows right here. So again, you can see that coming around and looping in between the right atrium and the right ventricle. And then again, this is the right ventricular outflow tract right here, the RVO that's labeled there. And then we have the left atrial appendage, which you can see right here with the left atrium back a little bit further posteriorly. So again, all of this represents the aorta. And then this right here, the one that's labeled number 1, the arrowhead there, that's representing the left main coronary artery. Here we have another view of the heart where we can appreciate a number of structures. So first off, we have the membranous part of the interventricular septum labeled by the black arrowhead in between the right and left ventricles. And then you can see the muscular part of the interventricular septum located right here. These arrows labeled 3 and 2, these are just representing trabeculations in the right ventricle. So that's so you don't really need to worry much about what those are. Just realize those are just part of the right ventricle, part of the wall of the right ventricle. Up here we have just a sort of a cross-sectional view of the left anterior descending, so the LAD, or the anterior interventricular artery. And then back here we can see part of the circumflex artery, that's coming, left circumflex artery, and that's located right next to this larger structure right here, which is going to be the coronary sinus, right as it's about to dump into the left atrium. And then up here, this is part of the mitral valve. So you can see this is just a single leaflet of the pulmonary valve. So again, that would be shutting off, obviously, the communication between the left ventricle and the left atrium. And then right here in between the left and right atria, we have the inner atrial septum, relatively clearly pointed out. And then up here, the one that's labeled number 9, you can see that this is representing a right pulmonary vein that's dumping into the left atrium right here. And then this structure here represents the descending aorta, which hopefully is relatively clear. And then finally over here, we have the right main coronary artery, and then a marginal branch that's just coming down off of that, which you can see right here to supply the right margin of the heart. Here we have a CT angiogram. So this one again is somewhat difficult to interpret, I think, in some ways. So I think you can make out that this is the left coronary artery, this is the right coronary artery, and then you can kind of see that as it's looping around and forming the posterior interventricular artery. And then this vein right here is representing the coronary sinus. So again, you can see that coronary sinus eventually going to be dumping into the left atrium. With the left coronary artery, this is where I think it gets a little bit more difficult to tell exactly what you're looking at. So just based on the planes of view. So this right here is the anterior interventricular, so the LAD coming down this way, whereas this is representing a marginal branch. And then back here, this is going to be the circumflex artery coming around posteriorly. So again, it's probably a little bit confusing based on this view. So that's why a 3D rendering, and by the way, this is a CT, so this is a 3D rendering of a CT scan of the heart. And so this is where you can really appreciate the coronary vasculature a little bit better. So here we have clearly our right coronary artery, so you can see the right atrium and the atrial appendage, the right ventricle, obviously right down here, with the right ventricular outflow tract, or the pulmonary trunk, located right here. Again, I think that's much clearer. And then here you can see the LAD coming down in the interventricular sulcus in between the right and left ventricles. And then over on this view, we've rotated the heart so that we can see the left side a little bit better. So now you can see the left ventricle and the right ventricle pulmonary trunk coming up here with the right pulmonary artery and left pulmonary artery. Here's the start of the aortic arch, and then the left atrial appendage. So the left atrium is basically this area back in here. And so this would be the circumflex artery, left circumflex coming back this way. You have some marginal branches coming down, and then the LAD right here. The arrowheads are just representing a vein, that's a superficial vein that's carrying blood back into the ultimately what's going to become the coronary sinus. And then now we have two additional CT views of the heart here. So you can clearly make out the coronary sinus, the IVC dumping into the right both dumping into the right atrium. So you see that close relationship between the two of those vessels. The coronary sinus is somewhat enlarged in this individual. And then again, you can clearly make out the right ventricle located right there. In this view down here, you can see the left atrium, and then the inner atrial septum is going to be this right here. So all of this area in here represents the right atrium. So we have the left atrium and the right atrium, and so then this is the superior vena cava, and this is the inferior vena cava, both of which are dilated and dumping into that right atrium. And then this would be the descending aorta back here. Here we have a 4-chamber view. So in this CT, you can see the left atrium, right atrium, so inner atrial septum, right ventricle, left ventricle, membranous part of the interventricular septum, and then this is the muscular part of the interventricular septum. And down here you see where there's this dark band, which you wouldn't expect since obviously the interventricular septum should just stay in between the two ventricles. This is actually evidence of a myocardial infarction. Down here you can see the dome of the diaphragm on the right there, the descending aorta and the esophagus right there, along with the azygous vein. And then this is evidence of a pleural effusion down here. So just a quick note on mammography. So obviously this is something that's widely done, so I wanted to make sure that we at least cover it briefly. So this is two separate views of the breast on mammography. So realize that a mammogram is an x-ray where the breast is positioned in between a detector plate and an x-ray beam, and the x-ray is then moves through the breast tissue. And so the image on the right represents what we call a cranial caudal view. So that's where we're looking down on the breast, so you can see the nipple here on the right hand side, and then you can make out the ducts as well as the suspensory ligament. So all of these kind of wispy structures that you see through here represent Cooper's ligaments that are supporting the breast. And then this one right here, this is a medial lateral oblique view of the breast. And so this is where you can see more of the breast tissue. You can see the pectoralis major over here, the nipple over on the right, and then you can make out again a number of the ducts, milk ducts that are located within the breast. And so, when we're doing mammography, this would be a diagnostic mammogram where we're just looking for, or a routine mammogram, where we're looking for any evidence of nodules or tumor-looking structures, which we don't see. This is a normal mammogram, and so if you saw anything, then you would progress to either do an ultrasound and or additional, more targeted x-rays of the breast. You can also do MRI of the breast, though that is somewhat less common, unless there's a history of breast cancer. All right, so I just wanted to review a couple of x-ray related images here, since there were a couple of issues that came up on the quiz this week, the quiz from Thursday. So just to review the counting of the ribs, make sure that you're able to accurately count both the posterior ribs in this case, as well as the anterior ribs, as you see down here with rib 6. And then another point is on this one, note that this is the visceral pleural line that you can see, and you can follow it all the way up on this image. And so, you want to make sure that you don't confuse that with the medial border of the scapula. So again, on this individual, it's based on their positioning, it's relatively difficult to identify the medial border of the scapula. But again, you just want to be aware. I mean, again, you can see obviously even the horizontal fissure coming across right here, and then the pleural line continuing down. So you want to see a full continuous line if you're looking for the visceral pleural line. So that's something to keep in mind when you're looking at x-rays. And then once again, looking at this image, make sure that you're able to correctly identify the different lobes of the lung, since that's how we'll ask questions about that on future quizzes as well. And then this is just kind of foreshadowing some of the content coming at you on Thursday as well as next week. So this is you'll be learning how to identify what structure is pointed out by the arrow here in this image. Now the rest of the slides that I'm going to give to you today, I'm not going to go through them all because I think they're really well labeled, but these are really exceptional, I think, views of the axial plane, looking at various structures at different levels throughout the thorax. So, there's also diagrams that are included to help you identify structures based on these. So it's a great way to quiz yourself before you take the quizzes for this week. So again, I'm just going to kind of walk you through, again, I'm not going to walk you through them, but I'll just scroll through them here real quick, just as a quick review. One thing to point out on this one that I wanted to note is on this is an axial CT. So realize that you cannot normally see the pleura, the parietal pleura. Normally it should be invisible. So what you're seeing, like the green arrows are pointing out the innermost intercostal muscles, and then the yellow is representing the invisible parietal pleura, and the red here represents a thickening of the parietal pleura, and so that's where you can actually visualize what the parietal pleura looks like here on imaging. So realize that the pleura normally are not able to be identified on imaging, or CT at least, and X-ray.